Good morning, Peter Goertz. I'm a psychiatrist. Does true love exist? You might feel it sometimes, my God, true love does not exist. So-and-so betrayed me. I can't trust her or him. But in my opinion, it does exist. And I'll talk about some examples. And what I'm talking about is family caregivers of patients. And that could be a wife, husband, so within a marriage, could be a son, daughter, mother, father. And people in families can take care of another person for years on end. That can be because the family member who needs to be taken care of is demented, has physical problems, has psychiatric problems, or a combination of all of them sometimes. For me, over the years, it's been really heartwarming to see family members take care of another family member. And for example, that can be a partner. And I just spoke with a partner of a patient who's disabled now, and the partner was saying some people leave their partner when things go badly as far as health, but they don't know what commitment is. So that was nice to hear that he felt committed to his partner and was taking care of the partner. Some examples: a patient years ago on a locked psychiatric ward had attempted suicide. She was psychotic chronically, and every single day her boyfriend came to visit her, and he had his own problems. He was in recovery from serious drug use, but every day he came and spoke with her, met with her, visited her on the ward. And I'm sure that helps people's recovery on a psychiatric ward, having that support. Another example, a patient with dementia. His wife has been taking care of him for years in a very loving, caring way. And another example, a patient who's chronically psychotic. His mother is very responsible and tries to get him the best possible treatment, very supportive. And this has been going on for quite a few years. Another example, a husband of a patient who had had a serious brain problem and then consequences from that, both physically and mentally. And he came to every single visit with the patient, very supportive, again, over years. Now, another aspect of this is an example I'll tell you, and that was a patient who was very depressed, suicidal, and he was telling me, that's not fair to my wife, for me to always feel like this. She needs some relief. She doesn't benefit from having a partner who's so depressed and suicidal. Now, the other side of that coin is his wife had had some serious physical problems not that long before, and he had stood by her very reliably, and my sense was the wife probably wanted to stand by him with his psychiatric issues. So we want to leave it to our partners and our family members, leave it up to them as to whether they want to stand by us and help us or not. Some people don't feel they can do it. One major aspect to look at is burnout, potential burnout of caregivers. And when I speak with a patient, for instance, with Alzheimer's, and their wife, for example, is in the room, I sometimes turn to the wife and ask, how are you holding up with this? And at times the wife has just burst out in tears, various people. So that tells you something. It's a lot of stress sometimes for the caregivers, and sometimes maybe they could have a little more balance if they let themselves. So sometimes caregivers don't feel that they can go out alone, let's say, and let someone else take care of the other family member for a while. But that may be worth looking at in order to avoid burnout and to have some balance in their lives. Now, when a patient dies, the caregiver can have various emotions, including relief, of course, but also sadness and potentially guilt. So even after the person who is being taken care of dies, there can be some difficulties for the caregiver. Thank you.